Welcome, everybody, to another session with Dr. Calvin Ng, and I'm joined here with Dr. Noah Lebowitz, who is somebody that I respect a lot and knows a lot about what we commonly talk about, similar topics like parasite infections, fungal infections, and we're going to take a deep dive. Most likely, if you follow me, if you follow Dr. Noah, you're probably following both of us, and because I'm always hearing about things from my patients about Dr. Noah says this and blah blah blah, which is great. So we're all part of the same tribe, kind of cut from the same cloth, and
Definitely.
learned applied kinesiology, which is an awesome technique. But today we're really going to talk about things like from the herbal standpoint, from Supreme Nutrition, and I wanted to give people more of a deep dive with those herbs because there's a lot of herbs in the Supreme Nutrition line, and I think they're amazing. But one of the things that I really love is like how it came to be. So Noah, if you can just explain and share with us the idea behind Supreme Nutrition, how it came to be, what's like so special about, and how clean everything is. What's the story behind it?
My dad, who founded the company in 2007, we were actually visiting the island of Kauai. And my parents used to live there. And a friend of my dad ran a taro farm. And he asked, hey, you want to come work in the taro farm and hang out with me for a day? So my dad was like, sure, that sounds fun. And so we got there, and the guy was like, well, just so you know, everyone that works in the taro farm gets leptospirosis. And my dad was like, oh, thanks for letting me know after I got here. And, whenever we go on vacation somewhere, we always go to health food stores. That's what you do. And you look in, you get your food, but then you look in the supplements, you see what's local. And my dad had got this organically grown noni fruit leather. And two things happened. One, my dad didn't get leptospirosis when his friend did get leptospirosis. Also, my dad would get recurring fungal/candida issues every 3 to 4 months. And after going through like 2 packs of this noni fruit leather, which is not the greatest tasting thing in the world, my dad didn't have like a fungal issue for over a year, which he's like, wow, this is pretty cool. And he had always, noni's been a popular product for a while. My dad never found it to be that effective. And he's like, so why is this effective but others aren't? And so he decided to get different samples of noni from different parts of the world. And a lot of the noni on the market is fermented, which we find loses a lot of the beneficial properties, but it's also, they add fruit juice, they add sugar, they add a lot of things to make it taste better. So you got samples from different parts of the world, and we found one spot specifically that tested really well when a lot of the other samples didn't. And, they all test well laboratory, COA, microbes, heavy metals, but then we were using applied kinesiology to see how our patients actually respond. And so my dad then started to use it on some of his chronic patients, and they had really good benefits. So he's like, maybe we're on to something. So every single batch, every company should be doing third-party lab testing, third-party heavy metal testing on all of your products. But then in addition to that, we get products that look good on paper, but then we actually muscle test them on people and see which one tests the best. And it's kind of cool. Like, I believe maybe it was our third product, ashwagandha. We had a lot of docs that said, I never found ashwagandha to work with my patients, but then I tried yours and it worked. Why? And it's not like we altered it in any ways. But, ashwagandha is one of those things it might be all organic and look great on paper, but we get in 8 samples and my dad's going to find 7 of them are horrible. And one of them does really well with his testing on patients, and we go with it. And by doing that extra level of testing, we really find people to do well. And then also we don't add any fillers, binders, flow agents. It's the herb, the capsule, and nothing else, which in your sensitive patients, we find really works well. So the patient is only getting what they need and nothing else.
The concept of taking the entire herb versus, just taking parts of it in the supplement world, in the herbal world, how does one even tell whether somebody is doing that? Whether you're taking the entire herb or whether you're just taking maybe like the root of it or the stem or maybe the flower part? Like, how does one tell when we just flip over in the back of the label and it says ashwagandha or something else?
I mean, with most herbs, there's beneficial parts in every type of an herb. But most herbs have one part of it that is like the best health benefits from it, or at least the most common. So, like ashwagandha generally is just the root. There are some companies out there that use ashwagandha leaves, but they haven't been studied very well, and there's a couple potential issues with that. So generally, though, from a legal standpoint, labels have to say what they're coming from. This is a fairly new regulation. Like on our labels, we've always used ashwagandha root, but up until about 2 years ago, maybe, we just put ashwagandha on the label. Now we actually have to list what part of the herb we are using. So now it says ashwagandha root. So nothing has changed, but now legally companies actually do have to tell you what they are using. Like Mimosa pudica. It's an awesome herb. I know you love mimosa. And, you have the seeds, which our product is 100% organic Mimosa pudica seed. And that has a lot of the anti-parasitic properties. But then you actually have the leaves, and those have different medicinal properties, which are kind of cool. So there are some products out there that use the leaf. There's some that use the seed, and there's some that use the whole product. And depending on the person and what they need, maybe a different part of the plant is better. But at least for the anti-parasitic properties, we have found the seed is the best part.
Okay, great. And I really like how you guys are using just the herb and the capsule and nothing else, because there's sometimes you see things like silicon dioxide, titanium dioxide, magnesium stearate, these other things in there that doesn't really seem to add any nutritional value.
Completely. In certain things, like let's take vitamin B12. You can't just give someone vitamin B12. The amount of active B12 in a capsule is like the size of a pinhead. So you have to add some type of filler. So certain things you do, in terms of vitamins. With herbs, you don't have to. But let's take ashwagandha as an example. So we have ashwagandha and a capsule. At times, it's taken us over a week to encapsulate, let's say, a year's worth of ashwagandha, versus if we were to add magnesium stearate. So magnesium stearate is a fat. It basically allows you to run herbs or anything through a machine much faster. So instead of taking a week to get enough capsules for a year, we could do it in one day. So that would drastically decrease our cost. But then if you use magnesium stearate or another fat, it's going to do two things. One, it's going to decrease absorption. Also, if you look at where is magnesium stearate coming from, it's hydrogenated, genetically modified cottonseed oil. I'm sure you and me would never buy anything if it listed genetically modified hydrogenated cottonseed oil. But then a lot of people think, ooh, I'm taking my supplement, this is really healthy. But then it has all these fillers that a lot of people don't even know where they come from.
What are some fillers that are so common that are really bad? Now, there might be some things that are acceptable, right? But what are the absolute no's,
Totally.
and then what are like acceptable?
To me, any type of food dye, any type of aspartame, those are like big no's. Magnesium stearate, there might be one product in my office I carry with it because I can't find one without it. But as a general rule, I don't have any stearates in my office. Titanium dioxide, that one they've actually done studies that can increase celiac and gluten sensitivity, among a lot of other things. There's a lot of other, like you can have literally antifreeze in with like propylene or propylene glycol or PEG. Like you can literally have a antifreeze derivative in supplements. Thankfully, those are in some of the junkier ones you're going to get at Walmart or whatnot or Costco. Sugar to me is a big one. And again, food dyes are a big no-no. In my mind, from a filler standpoint, so what would fill up the capsule with, let's say, B12, you can have cellulose, which is basically wood pulp. That's probably the best one out there. There are a couple people that might use rice, which can be good also. Or some things are sticky, so you can't run them through. Leucine is one of I think it's a better one for sure. The one issue with that, so I use Thorne Research for a lot of vitamins. And if you get one or two products with leucine, no big deal. But let's say you're taking 5 different products that all have leucine. You can throw off your amino acid balance by taking way too much leucine and not your other amino acids. So too much I've definitely seen cause issues. Ascorbyl palmitate's another one that kind of helps to flow, and I would say that ascorbyl palmitate or leucine are probably the two best in my opinion.
Got it. And the tinctures um, is a lot of times they're cut with glycerin or cane, alcohol, and things like that. What are you guys using, and what are kind of like the nuances with the tinctures?
So, I mean, one, it depends on what the herb is. So, certain herbs, if you just do a glycerin extraction, they're going to be super weak. They don't really pull much of the active part of the plant. So, you can do it, but it's really weak and not super potent. Alcohol, as a general rule, is a better thing to use to extract the beneficial properties. But a couple things to think about that. One is, if you're doing a few drops, no big deal. But if you're doing a few different tinctures, the amount of alcohol, you could be getting a couple shots in, which definitely isn't good for your liver, prostate glands, and all of that. But also, again, if something just says alcohol, or if it says grain alcohol or ethanol, almost always it's GMO corn ethanol, which is obviously not going to be ideal. There can be glyphosate residue, GMO, there's a lot of different aspects of that. So what I personally like as a best case, we use an organic cane alcohol, so non-GMO, all organic, to do a strong extraction. And then we burn off as much of the alcohol as we can at a low heat, which keeps the integrity of the beneficial properties, get it down to 3%. So it's almost no alcohol, and then add an organic glycerin. Also, glycerin can come from some glycerins, if it's just vegetable glycerin, that can be from GMO cotton. So we're using generally a organic flax-derived glycerin, which seems to be the best, and also it makes it tasty for kids.
Yeah, I like that there are the tinctures now that where it's easy for kids to take. And that's probably a good place to start actually for, application for kids and their problems and their issues. And one of the biggest things that I would say kids get is they're very susceptible to parasites and fungus. What are some of the things that are just so easy and effective for kids to take? Very common. I'll tell you one of my favorites is going to be Scutellaria. I think like everybody who has kids need to have Scutellaria in their cabinets. I feel like that to me, almost from what I've seen, at least in our region, is like that Swiss Army knife where I'm just like, wow, that thing works for multiple issues. Ear infections, fungal infections, psoriasis, and well, they're typically not having psoriasis, but they're having eczema and rashes,
Yeah.
stuffy nose, swollen glands, things like that. What would you say are the top things for kids?
I mean, the foremost things that I use, I think of viral issues, colds, your common snotty nose, elderberry. That's a classic one. Everyone knows about elderberry, but it really is a great antiviral. So that's kind of a classic if you think about it. The two that I probably use the most are Scutellaria and black walnut. So if you think of some of the more, especially eczema, tummy issues, rashes, they can often be caused by a fungal issue or a parasitic issue. And so black walnut is a great anti-parasitic. It works amazing. And, I'll use it in kids 6 months and over. I'll use pretty much the tinctures that I'm going to mention 6 months and over. So black walnut, I more so think parasites. I had a kid with swollen lymph nodes and I gave him black walnut today for that. Or then Scutellaria, like you mentioned, I think fungal mold issues. I know my dad's been using Scutellaria bicalensis for over 20 years for fungal issues, but then it also has good anti-Borrelia properties for Lyme disease. It has good, a lot of people are using it with COVID-19. It has a lot of good antiviral properties. It's also can be a good one for RSV in some cases. So it has a lot of beneficial properties that I love for kids. And, like you mentioned, eczema. Three things I see in eczema. I can see food sensitivity sometimes, but then often there's a parasite or there's a mold or fungus linked. So black walnut, I've had so many moms wrote me saying, hey, within a few days of using black walnut, all my kids' skin issues went away. Or Scutellaria, if it's more of a fungal issue, they use that and their kids' skin issues went away. So those are two of my absolute favorites for kids that I think everyone should have on hand.
What's kind of like the dosage that you're using for kids for Scutularia and black walnut tinctures?
I mean, I will admit I do a much higher dose with my own kids than I probably should. With you kids, you always play around a little bit and whatnot. But, so starting at about 6 months, as soon as they're able to start consuming food, I'll start using. I mean, I'll probably, at a young child, like 6 months old, like I've had more and more kids lately at that age that are constipated. And with constipation, it can be a dairy issue. Totally seen that. But also I see parasites a lot in young kids. And I'll literally give them like 2 drops 3 times a day. And I've seen it work wonders within a couple days. So I kind of start on the low end of like 2 to 3 drops at the 6 month mark. And then dosing based off of weight, but also age. By a year, I might be using 5 to 8 drops, and then year and a half in that 10 drop mark, and just kind of working up from there. Once a kid's like 3 to 4 years old, I will definitely increase the dose. Also, it depends on the symptoms. So, if you have something that's a kid's had for a long period of time, you don't need to use a super high dose. But one thing I've used a lot lately for pneumonia and for other respiratory issues, I've used a lot of Usnea, which is a great antibacterial, great for respiratory, great antifungal. I'll have people do that in severe, acute illness, a full dropper 4 times a day. It's like I'm not scared to go higher dose for younger kids in something that's really acute versus, again, something that's a little more chronic. I like doing a lower dose for a month or two just to kind of get it out in a slow, easy way.
I don't know how high of a dose that you have done personally or with patients or with your own kids or family, but I find that because I like to do high doses for myself personally to just kind of see where those limits are. And then occasionally there are many cases where I will actually do high doses for a patient. But what I notice with Supreme Nutrition products is that, especially the tinctures, is that I can take that dose really high. I'm talking about like multiple dropperfuls, multiple times a day with little issue. Versus sometimes with other companies, whether it's a similar product or similar action or mechanism, you might not be able to do that right away, or you might not be able to do that at all. I mean, have you had any experience with that? Or I don't have really much of a theory. I think maybe my thing is like, because things are so pure, it's just is what it is, that there's no other thing in it. My thing is, it's not your, sometimes when you're high dosing some other products, maybe it's the alcohol, maybe it's like the contaminants, right, that people are reacting to. It may not always be the herb. So have you had any experience like that?
Definitely, I've seen sometimes it can just be the alcohol, like you mentioned. That's very valid. Another thing to keep in mind is, a lot of tinctures on the market, they might be using an herbal extract in it. And if they're using an extract, a lot of the times they're using different chemicals and whatnot initially to increase the strength, and there can be chemical residue left over from making the extract. I've seen that cause issues. Also, when you make when you tinker with ratios, I look at God-given plants in their natural state. So, I find people like there's a good quality, but there's a ashwagandha extract, KSM. It's a really popular one that's used in a lot of things. And so they really just increase one aspect of ashwagandha, but then it skews off the overall ratios. So if people ask, the amount of withanosols you're going to get, it's a lower amount in our products, but people tend to do much better and have better responses because it's the full spectrum herb and we're not altering the ratios. Also, a lot of products on the market are kind of like a shotgun. So if you look at like an anti-parasitic, if you get an anti-parasitic with black walnut, with neem, with clove, with thyme, with, all these different types of herbs in it. If you or I did our kinesiology and tested a person on each individual herb, it's super, 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 super rare that you would need each one of those ingredients. So that's the beauty of us being able to test people and say, okay, you just need this one or you need these two ingredients. We can give them to you at a therapeutic high dose, and we're not giving you the herbs that you don't need. And people really respond well to that.
Yeah, that's beautiful. For the kids, how young would you, say this is too young, or, you mentioned 6 months, but is there really like too young and you can't, throw a drop in there type of thing?
No. I mean, generally, once a baby starts eating solids, I like to introduce things if they need. Most of the time before then, I will just dose the mom and I might give the mom a double dose, assuming the baby's breastfeeding. If the baby's breastfeeding, I like to treat the mom, give the mom a high dose, and the baby will get it. And I've seen that work amazing. It's more, I've had the issues where the baby isn't breastfeeding and they're bottle feeding. And like I had a 3 month old, I think, do 1 drop of black walnut twice a day, and it got rid of its constipation. It was great. But I usually, again, try to treat mom up until they start eating food. But if a child did have RSV or something serious at 3 months old, I would definitely consider giving them a low dose of something directly to give it. But I would also be treating mom.
Got it. And what is considered like safe while nursing for mom to take? And then what would be like absolute no?
With herbs, they're always very interesting. So some herbs have been used during pregnancy or while breastfeeding for thousands of years, and they're known to be safe. If you look at Ayurvedic or Chinese medicine, these are known to be safe. Then you have some herbs that are like known to cause miscarriages or known to cause other things, which are a big no, no, don't do it. And then there's a lot of herbs that, from all the research we've done, we've never found an answer. Is it safe or is it not? So I personally shy on the side of caution. And if it's known to be safe, great. So like during pregnancy, my main herbs that I will use, one is Vital Guard, which is chrysanthemum flowers. I mean, Korean culture, that's really big. They use tea, but that's kind of a classic antiviral. Sometimes I have had moms use it for parasites. Scutellaria, which we talked about, that is an amazing one that is pregnancy safe also. And then also for viruses, but my wife actually used it for a fungus when she was pregnant, Elysium, which is star anise. It's my absolute favorite for the flu, other viruses, and again, it has some antifungal and antiparasitic properties. So those are like my go-to during pregnancy. There are others that are safe, but again, those are kind of my go-tos. And then while breastfeeding, the one herb that I'll kind of usually add in a breastfeeding is olive leaf. That's a great one. Some people will use it during pregnancy. I usually don't, just out of extreme caution, but I will use that during breastfeeding. I think my son was about 3 months old and my wife was having some issues, and I gave her Mirinda, and I gave her a very low dose. And my son had diarrhea for 3 days. So again, I might experiment on my family more than I would with other people. So with a lot of those, I really try to be very cautious with. I know one question I get asked a lot is, why can babies take black walnut, but I tell breastfeeding moms not to? It's safe for breastfeeding moms to take, but black walnut can actually decrease milk supply. So that's why I generally recommend against it, not because it's unsafe, but obviously you don't want to decrease your milk supply.
Yeah, very good. Speaking of black walnut, some people are concerned with nut allergy. Do you have concerns about that? Personally, in my practice, I've never seen a bad reaction. If somebody has a nut allergy and they were to go on black walnut, as long as it's a clean source, for me, I've never seen a case where they've had a bad reaction from it. I do have patients that are just erring on the side of caution and they're afraid and they just say, "No, I'm not comfortable with trying it." And I say, "That's okay. That's fine. There are other things that we can do." Have you seen that to be a case with black walnut and nut allergies to be an issue?
I've never given it to a patient with a nut allergy. So I haven't personally seen it. I've heard of maybe 1 or 2 cases where people reacted to it when they had a bad nut allergy, including walnuts. So if a child had, let's say, a peanut allergy, but did okay on other nuts, I would say take it no issue. But if you were allergic to most nuts or definitely with walnuts, out of caution, I wouldn't. But it also depends on what type of allergy do you have. If you have an anaphylactic reaction, no, it's not worth it. But if you're like, oh, if he eats nut, he gets 1 or 2 bumps around his mouth as a rash, then I'd be like, okay, let's try it. Most likely it's going to be fine. But if the rash occurs, I would stop. For those cases though, the parents want to be cautious. I don't blame them. A lot of the time, it's kind of a gentle, but also it's gentle but effective. I like Artemisia. Artemisia annua, it has some good antifungal properties, but I look at it as an anti-parasitic, and it's more on the gentle side. So for parents with kids that do have a nut issue, often I'll opt for that and just have them like mix it in applesauce. It's a very mild tasting herb. Like, don't try to mix Malia or neem leaf in anything. It is so disgusting. Your kids won't take it. But like Artemisia, it's super mild. Same thing like mimosa. I didn't realize this. I was giving mimosa to my daughter. I think she was like 2.5. The problem with mimosa, it doesn't have a bad taste, but as soon as it mixes with liquid, it turns into this gelatinous substance. So I couldn't mix it in applesauce because it turned into these long streams. So what I found out is put applesauce in a spoon, sprinkle some mimosa on the applesauce, then have my daughter eat it, and it works great. So, sometimes you can work around it if you need to.
Yeah, I agree on Malia. Still have never had good luck with that with the kids. It's just not a fun herb. And then another one with I would say
Totally.
Morinda is like noni. Noni, I think the herb is okay, like the if you open up in a capsule, but the dang fruit itself is horrendous.
Yes, our pills aren't a bad taste. I've mixed in applesauce and given it to my kids, but yeah, if you eat the fresh fruit is just gross. I will say fresh fruit, freshly squeezed juice, for whatever reason, it tastes a lot better than the fruit itself, but still not my go-to.
Right. Okay, cool. So, all right, we've been talking about parasites a lot. What are some, you mentioned Artemisia, which I love using. And then Malia is another one, right? Morinda is also not always the first choice, but that one also will test
Mhm.
at times too. And then Golden Thread, Vidanga, definitely, Black Walnut for sure. Are there other ones that I'm missing here? What are some other? How are you using things like with the in the parasitic realm?
So like, you pretty much nailed, again, we do specific testing. So I have like my top 5 things that I will use for parasites. Every now and then I give someone number 10 on the list, and that's what they needed, and that's what works. But definitely like Malia, Artemisia, Black Walnut, Vidanga, Mimosa, those are like what I think of when I think of parasites. And like you mentioned in the very beginning of this, you and I, we probably agree on 95, 99, we agree on most things. We do some things a little differently, which is cool. We all have slightly different variations. So like when I do herbs, the way that my dad and I do things is different than how some people do them. We will generally give someone an herb. We don't pulse it. And I don't personally worry about moon cycles. Not that I don't see an increase of symptoms during a moon cycle, but generally, if I give someone an herb, I will have them take it for 30 days straight or until I see them next. So sometimes if I see them in 2 to 3 weeks, I might tweak it, but I usually have someone take an herb for parasites daily for about a month. And I find doing that seems to work well, just doing it on daily instead of, 3 days on, 3 days off, or just taking it that way. That's my personal approach to things, and it seems to work.
Same. I don't worry too much about the moon cycles, although it is during the moon cycles, it helps when somebody goes, "Oh my gosh, it's a full moon. I have increased symptoms. I should probably think about doing some sort of testing or parasite cleansing or something. I should take some action." But I don't.
Totally.
There's some patients that come in and say, "Oh, don't I need to start my parasite cleanse or these herbs for parasites during a full moon?" And I go, "No, like let's get rid of them now because the moon cycles. It is true that they react with the moon cycles and that they turn into different, like they go through its different life cycles." Egg, larva, worm, etc. But it's like I'm trying to kill everybody. I'm trying to get all
Totally.
these guys out. I'm not just trying to go after the worm. I'm trying to get the whole family out of there. So I would just say start ASAP as soon as you can. Is there anything where obviously for us, I love doing. I'd rather my preference is obviously going to be like come in, get tested, etc. But people online they may not want to do that. They may not have access to, whatever the case may be. Is there anything where you're like, I'm comfortable with people just trying this or starting this or maybe starting a low dose on this? Is there any like herbs that in the parasitic realm where you're like, yeah, I'm comfortable just kind of blindly going one at a time and trying?
With all the ones that I mentioned, theoretically, I am okay with. Of all the ones we mentioned, Malia is probably the strongest. And I mean, I really have the belief, you might have a couple weird days as your body adjusts, but I'm always of the belief of when starting a protocol, you should feel better. I don't like my patients to crash and just feel worse. To me, that means we're probably on the wrong supplement, especially if it lasts more than a couple days. So, if you're not working with someone in person, like you mentioned, I do think it's best probably to add things in one at a time. I'll usually start on a full dose, so 3 pills a day. But so I'll say, okay, if my top 2 antiparasitics were Malia and Vidanga, I'd be like, okay, start a Malia, take it. And if, assuming you're not feeling worse after 3 days, then add in Vidanga and taking them for a month. With herbs, if you take the right herb when you need it, it can do miracles. When you take it the wrong herb when you don't need it, your body usually lets you know. So as long as you don't be like, oh, I started taking this herb and I've had diarrhea for the past, but I kept on taking it for the past month. No, that's not the goal. If you listen to your body, listen to your symptoms. So if you start on an herb and you feel worse, then then it might be your body telling you, okay, this isn't the right thing for you. Again, maybe you take something the first dose and your stomach's like twisting because it's killing stuff off. That's fine. But, you shouldn't have these major, major die-off reactions. And if you're not, I'm okay with the trial and error of the different herbs personally.
Yeah, I would say that for people, I would say most people generally respond positively. And then occasionally you have like very sensitive folks. There could be many factors like emotional stress, etc. Or you could be disrupting some things. But I would say give it about 7 days. If you're like 1 week in and you don't feel good, that's probably not the right track for you to be on, right? Generally speaking. Are there exceptions? Absolutely. Because, I've seen people that are super sensitive. They can walk into a hotel and immediately be like, no, there's mold all over the place. Can't do it. And just from that one sniff, they have headaches for the next week or two. And then there's those types of people. And then there's people that are like, yeah, I can crush. I'm like that, where I can crush high doses of herbs and not have an issue at all. And it really takes a lot for me to not feel good. So
I
again,
think
there's a
that's a great
range to
approach.
all of this.
Completely. And, with herbs, I like, with, let's say people come in and they're having GI issues and we think they might have parasites. Personally, I'm probably using 2 or 3, I'll call antimicrobials at once on a person. And, if people are trying on their own, I like to see results fast. I'm very impatient, so I always say, if after a month's worth, if you're continually getting better every day, but you haven't either got all the way better or you haven't plateaued, keep doing it. You can do them longer. Keep going until either you get all better, which is amazing, or if you plateau, then that might mean things shifted and you need to try something else. So if you're on Malia and Vidanga and got 40, 50, 60% better, but then you kind of plateau, then you got to think, okay, what could be next? Maybe it's Artemisia or Scutellaria or something to try to get to that next level. Or again, if you take a couple antimicrobials for a bottle of each and you don't notice any improvement, hopefully they still had some good beneficial properties for you. They increased your immune function and whatnot, but it probably means they weren't the ones that were going to deal with your issue. So then let's try some of the others to see if that can really increase our symptom or decrease our symptoms, making us feel better.
Yeah, beautiful. For fungus, which is a huge topic, but for fungus, candida, yeast, what are your go-tos, and what are some even some novel ones that you might do or apply? Where we can go into essential oils and things like that too.
A couple that you mentioned for parasites. I mean, the beauty of herbs is they do a lot of things at once. Like if you take a prescription antifungal, it's pretty much just a prescription antifungal for a certain type of fungus or mold. While herbs, like if you take neem, or Malia, if you ask my dad, that's his favorite antiparasitic and it's his favorite antifungal herb. So it does two things at once. It's hard if you're using natural medicine, you don't like just go after one thing at once. You're automatically doing multiple things at once, even if you're not trying to. So like, Malia, Morinda and golden thread, like those are my three most common herbs I use for everything. So they're great antiparasitics, they're antifungal, they're antibacterial, so they work well for all of those. Scutellaria is a great one though that we talked about for kids and for adults. I love Scutellaria. It has Candida properties. It has it also, the thing is, with herbs aren't just like an antibiotic. They're not just killers. Ideally, they're helping your body heal. They're helping your body fight things. So like Scutellaria, in addition to having anti-Candida properties, it can actually help to modulate interleukin 17, which can help lower inflammation in the body. So, it does many different things at once. Since the goal of natural medicine, it's not like Western medicine. We're not taking something just to kill this. We're trying to enhance our body's immune system. We're trying to increase our liver function, increase our immune system so we can actually fight off these pathogens also. We're just trying to assist the body in doing what it was made to do. But like I said, Scutellaria is a great one. If I had to pick one other that I actually really like for fungal issues, Uva ursi, which Uva ursi is a classic UTI herb. Like anyone tells me they have a UTI, 2 pills, 3 times a day between meals, love it. But if you look at labs and a lot of things, Uva ursi has a lot of great anti-Candida properties. So it's really beneficial for fungal issues. And then kind of one thing to loop it all together. So a lot of people that have bladder issues, including UTIs, it can be linked to high oxalates. So like, people that get kidney stones, eating too much spinach and things like that. So Uva ursi can actually help a person excrete oxalates out of their body. But also, if you have a fungal infection, that's going to cause your body to make its own oxalates. So it's cool because Uva ursi, it's great for UTIs, it's great for fungi, and then it's also, getting rid of the fungi will decrease your body's production of oxalates, and then also helps excrete the oxalates. So it's an awesome all-around bladder herb, but it does so many other things out there, antibacterial properties, antifungal. It's one that I'm actually taking right now. My dad put me on Uva ursi and cat's claw yesterday, so 2 kind of classics.
Yeah. Cat's claws I think is great for fungal issues as well. But that's another good antimicrobial. I feel like cat's claw sometimes is overlooked too. It's not well known. Most people will talk about kind of like the ones we just talked about, but cat's claw. And then for like the Lyme infections, that's another good one for that. So really like cat's claw. For now, expanding on fungus, we then enter into mold, which that's a whole loaded thing too, right? But it seems like a lot of people are just kind of like, okay, let's just pull mold out of the system, detox mold, etc. Your view is that we should assist the body. Number one, get rid of the fungus that's producing the mold toxins. Usually it's not the mold issue, it's the mold toxin issue. So you got the fungus, right? The little fuzzy stuff, and it's releasing its own toxins. And that's what we're reacting to negatively. So you want to get rid of the mold, you want to get rid of fuzzy stuff, you want to get rid of its toxins altogether. So definitely need to do fungal cleansing on that end. And now, what about things like Takasumi, the binders, or Shasandra for like liver function? How do you handle mold?
With handling mold, I mean, the couple things we want to do. One, we obviously want to make sure you're not being re-exposed. If you're living in a moldy house, it's going to be very hard to get over any type of fungal issue. You breathe in the mold, it starts to grow inside you. Same thing if your spouse has any type of fungal issue. One kiss, you pass things back and forth. So they might need to be treated also. So you want to avoid exposure. So, and my dad and I are huge into people that think that might have fungal issues into doing a antifungal diet. You know, I have that post on my Instagram, but avoiding sugar, avoiding honey, avoiding maple syrup, avoiding fruit juice. We do allow fresh fruit though, and we haven't personally seen that to be an issue. But then we also have people avoid mold fermented products. So we don't allow people to do miso or tempeh, soy sauce, vinegar even. You know, I have vinegars, it's not a bad food, but we've seen it benefit people when going after a fungal issue to avoid it. So those are things we always have people do. You know, if you look at, like you mentioned, you know, so let's say if you have a Candida albicans infection, that Candida can produce over 200 different mycotoxins. So it is a mycotoxin factory inside your body. So it's like before thinking of going after the toxins, you need to kill that active fungal infection or you're really not getting very far. So I definitely do think doing those two things are really important. You know, most of the, there's no, so in terms of getting those mycotoxins out of the body, you know, I will say most of the time I go after the active fungal infection. So using the herbs like Malia, Scutellaria, fungal diet, patients feel amazing. Doing that, you have such dramatic improvement in one's health by going after the active infection that I just see it do wonders on a day in and day out basis. A lot of the times I don't seem to need to do special things to get rid of the toxins. Why is that? I don't know. Is that either because the body just kind of puts them in the background and they're not causing issues, but they're still there, maybe? Or is it because if you have a fungal infection, that's going to overload your liver. That's going to, with benzene and acetaldehyde, that's going to overload your kidney with ammonia. And once you get rid of the fungal infection, your liver's going to be working better. Your kidneys are going to be working better. So then they can get rid of the mycotoxins on their own. But definitely for some people, they need extra help with the top mycotoxins. Smilax, which is sarsaparilla root, that's a great endotoxin and mycotoxin binder. Also, if people ask me my favorite detox for heavy metals or chemicals, I'm always going to say Takasumi. I have other things that I use, but that's what I use most often. But that's also a great mycotoxin binder. I know some people are unsure about it because of the charge of it and does it bind to mycotoxins, but I have to say I've seen it work a lot when mycotoxins are a big deal. Takasumi does work well. So there's only benefit, there's no harm of adding Smilax or Takasumi in as a binder when going after mold or fungal issues. But I don't see it as a hard, fast rule that you need to in all cases. In some cases you do, but it's not like everyone needs to.
For the Smilax, do you have people also avoid food and supplements, medication like Takasumi?
It's weird. Like Smilax, it's an atypical binder. How it works, I can't give you a solid answer. But I've had people take it with food and other pills and it doesn't seem to affect it. While Takasumi, you definitely want to take away from it. Like I remember this patient that they had all these muscle cramps and constipation. So we give them magnesium, got rid of all their symptoms. And then later we put them on Takasumi and all their symptoms came back. And we found out it was because they were taking Takasumi right at the same time as they were taking their magnesium. So the Takasumi was binding the magnesium and they weren't getting the benefit. So definitely that's why you want to dose it at a different time of day. But Smilax, again, I don't know why, but it doesn't seem to be an issue that way.
Got it. Very good. Sometimes with fungal infections, using like essential oils, right, which is talked about in the Bible as well. So very, very old traditional use of it is common. Now, you guys also have BFB1 and BFB2, right? Do you guys, I use that for multiple things, definitely for biofilms. It stands for biofilm buster, but I use it for multiple things. But do you also use it for infections, fungal infections, parasite infections?
Yes, and in two ways for that. I mean, sometimes for topical issues, if you look at a lot of skin issues, I mean, if you look at ringworm, you look at jock itch, you do different things like that. Usually you want to treat it internally because usually you're going to have a systemic issue, but I like to treat it topical also. So using BFB1 or BFB2 can be really beneficial for that. But so if you look at biofilms, so biofilms are a way that infections wall off and hide in the body. And then kind of like out of science fiction movies, there's something called quorum sensing where they can like talk and communicate back and forth. And it's like when you get stressed, they're like, ooh, their immune system's down. Let's come out and attack and try to grow. It's really creepy, but that's how these biofilms can actually work together. And so, if people seem to get recurring parasitic infections and they're not like, a chicken farm or something like that, or if they're getting recurring fungal infections or bacterial, all of those things can be biofilms. So we've actually had people just applying essential oils topically on the thumbs, the earlobes, and the toes, and it gets absorbed inward. And we see it work really well, again, for breaking down those biofilms. Of all the times if a person's going to have some type of like Hertzheimer reaction or die off, I still don't see it that often, but the highest chance is going to be with a BFB because you're breaking down biofilms where old lingering infections are hiding out. The cool thing about essential oils is they don't just break down the biofilm, they're strong antimicrobials and can ideally kill the infection inside. But sometimes people will have die-off reactions just from exposing all this stuff. Also, the biofilm matrix can be made of heavy metals and other things like that. So sometimes the body has to dump those after you attack it. But, the BFBs are interesting because I have a lot of people where I use them and I think they're a part of the protocol, but they're not a huge part. I call them a small part. They're important, but they're not like the bread and butter of it. Or maybe I should say ribeye steak. I don't know, whatever the most important part of the meal is now. But then, on occasion, I've seen some patients where literally I only used BFB and they did miracles. Like alopecia, where hair just completely grew back after using it, or decades of chronic fatigue, or I've had a few patients where, 5+ years of prostatitis and prostate issues gone away within days of using it. So it's kind of interesting. Like a lot of people, it's more subtle in the background benefits, but I've had more quote unquote miracles just from that than most other things.
Do you ever do diffusing of the BFB oils? For instance, for like lung issues, because sometimes biofilms, well, often biofilms, mucus, and all that stuff builds up, right, in the lungs and mucosal tissues. Do you ever have people diffuse it?
We will have people diffuse things sometimes for sure. I mean, a lot of the it'd probably be beneficial to do it more often because, a lot of, if you look at the sinus issues, I mean, a lot of people have fungus living in the sinuses. So I think breathing it in for anyone would be beneficial. A lot of the times if someone's living in a place with mold and they can't get out, I will have them run essential oil diffusers and I find that to be beneficial. But I think definitely sniffing it can be really good to help clear out the sinuses, which don't put the oils in your nose. I've done it. It burns. I'm just going to say, don't do it.
Yeah, the oils do burn. Oral Supreme burns too. Like when I put Oral Supreme every day in where the teeth meets the gums, it does have like a little minor tingle sensation. But if you notice that you have more inflammation going on, it actually will burn a little bit more. So it's very interesting. So that's another good one too, Oral Supreme. And for a lot of dental issues, I love it. What's interesting? So I've been blessed. I need a knock on wood for this one. I've been blessed with pretty good like dental hygiene, dental health, and all that. Not that I'm perfect and I take care of myself. I definitely don't floss every day. I will admit that. But for some reason, my oral microbiome pretty good. Knock on wood. But there are times where I do feel a sensitivity in my teeth, and then I go gangbusters with that oral Supreme, and then it clears it. Like within a few days, I'm like, oh, I totally forgot that was there. Do you use that often? What have you noticed with the Oral Supreme?
I mean, I actually keep it in my car. So when I drive to the gym in the morning, I just apply it when I'm driving. So probably like 5 days a week I use it. Not, so not every day, but 5 days a week. I mean, a lot of people use it just as a breath freshener. It works great for that. But if you think of plaque buildup in the mouth, plaque is a biofilm. So by using the Oil Supreme, you're helping to prevent plaque buildup, decrease biofilm production in the mouth. Also, if you do it's a dark field analysis, or if you do an analysis with a lot of swabs from the mouth, you see a lot of protozoa in people. And I've seen people that always had protozoa and then they use the Oral Supreme and it goes away, which is pretty cool. The only other one thing, I'll just completely off topic, but I was just talking to my dad about it recently. I had a filling, so I don't have quite as good oral health as you do, but I had a dentist do it and it just didn't. I don't know. I had nerve pain after it. So it was interesting. He went in, he shaved it down, didn't work. Went in, changed it again, didn't work. I actually had him redo the filling, didn't work. Super frustrating. And I actually put on, there's this company, Pure O3. I don't know if you ever use them. It's like an
Oh,
ozonated
ozone.
oil. Yeah. So I just did this olive oil ozone basically that I keep in the fridge. Is pretty thick. And I had this going on for over a month at this point, and I put it on around the tooth that was sore. Literally within 2 to 3 days, 100% gone. It just blew my mind of how well it worked.
Yeah, big fan of ozone. I think it's miraculous. I actually was asking a dentist yesterday, or a vet dentist. I was like, can
Mhm.
I put this stuff on my dog? Because she's got a tooth that needs to come out. And my thinking is, well, maybe I could use some like ozonated olive oil. I don't know. But all right, let's see here. It is 2:29. How are you doing on time, by the way?
I got another half hour if you want.
You got another? Okay, cool. So let's do that. Let's do maybe another 15, 20 minutes.
Sounds good.
Okay, cool. All right. What do we talk about? We ended up with
We've done parasites, we've done mold, we've done biofilms, herbs in general.
yes. Okay, so let's go into the glandulars because that's
Oh,
pretty
sorry, I just
new
lost you for a
stuff.
sec.
The newest stuff. Okay, so glandulars, it's been around for a long time.
Yes.
It's standard process, right? 101, like eat the thing you want to fortify. That goes even before supplement companies. That's like ancient, medicine, if you will. Now, you guys have just started with the grass-fed sheep glandulars, which is very unique actually, because most things are bovine based. So, what was kind of
Mhm.
like the thought process behind grass-fed sheep?
I mean, the one thing that I always like to say is, I'll never talk bad on sheep glandulars. I think they are great. Personally, I think the sheep I have found to test slightly better. But again, I'll never talk bad about bovine glandulars. But a couple things. I mean, as a general rule, sheep is looked at as more hypoallergenic than beef. So you definitely have some people that don't do well on beef that do well on sheep. So they benefit from this. Another thing which I do think is important, we live in a toxic world nowadays, unfortunately. There's no way around it. I mean, our glandulars come from 100% grass-fed New Zealand sheep, which is we try to be as clean as we can get with that. But sheep are generally slaughtered at a younger age. They're usually slaughtered at like a year old, while cows go 6 to 12 months later. And I think because of that, they tend to be less tainted by all the toxins out there. So I think, sheep, it tends to be a little more hyperallergenic, but also the younger slaughtering age does increase the quality, in my opinion.
That's really interesting. You say about the people; it's more hypoallergenic. Although sometimes people may not like the taste of lamb or sheep because they might say it's gamier. I think that might be more a preference thing. Again, that has nothing to do with the glandulars. That's just more like eating the meat itself. But that's really interesting you say that because there are some people that very rare when they do bovine glandulars, they don't feel that good. They might feel a little queasy. Usually nothing, not a horrible issue, but they do feel like they might have some skin breakouts. So this would be
Mhm.
interesting to see if those people who react negatively to bovine glandulars, if they do better on the sheep glandulars. Okay, so we
Also,
have.
one thing,
Go ahead.
oh, one thing. So, I mean, I love liver. Liver's like a superfood to me. It is. But I definitely have some patients that don't do well on liver. And a lot of the bovine products on the market, they're all cut with liver. So you might get thyroid with liver, thymus with liver, testicle with liver. So while I think liver is a superfood, I definitely have a lot of patients that don't do well on liver for whatever reason. So kind of like with herbs, I've definitely found, people might do better on our thymus or the testicle or the heart because it's not mixed with liver for the people that don't need the liver, basically. So that's kind of one other thing that, again, I love liver, but some people that don't do well on it will do better on the others because it doesn't have it added.
Yeah, good point there. And everything is pretty much the entire thing, right? Freeze dried, the entire organ, right? We're not taking any, it's not an extract. You're not taking parts of it. It's the real deal, pretty much.
Exactly. And, it's interesting, like, if you take sheep testicle, that was kind of, I've been surprised. I use it probably 50-50 in men and women in my practice. I thought it would just be for men, but I use it in women almost just as much. And I've had a handful of men where, there's very little testosterone in the sheep testicle, but it contains everything that the testes need to make testosterone. So I've had a lot of guys where on lab tests, people with low T, they've taken sheep testicle for 3 months and their testosterone's gone up 30 to 50%, which they've been thrilled with in terms of how they feel and that, because again, it's not like taking a steroid. You're not doing hormone replacement. You might be getting tiny, tiny bits of testosterone, but really you're just helping the testes to make more. And I see that as a big benefit.
30 to 50% testosterone increase with sheep testicle is huge. That's major. So that's significant optimization there off just one thing. And that's kind of like just, again, giving the body what it needs. Eat the thing you want to fortify, and the body will kind of do it itself, right? What have you noticed
Definitely.
with females taking sheep testicle?
The main thing I've used is women and libido support. That's the main thing for women. I mean, some tell me that they have low testosterone via lab tests or whatnot, but with libido, it can be a lot of different things. I mean, more often with libido, so one of my favorite female herbs, which I probably use it 20% of the time with men, one of my favorite female herbs is shatavari. So shatavari is a pregnancy safe adrenal adaptogen. It is amazing at increasing breast milk supply for postpartum mamas. And it also has some antibacterial properties, different things like that. But a lot of people, women, it especially increases libido. So that's like my first one go-to for there, because again, it's acting on many different aspects. It can also increase gently progesterone. But for otherwise, yeah, for the testicle, I've mostly used it more often postmenopausal, but sometimes premenopausal for libido support.
Yeah. Do you have speaking of libido, the other one that I will use sometimes for that is Lurong, which I use a lot for males. Do you also have people use that for females too?
I will use it in females because, I mean, I've used it for libido support. I've used it for testosterone support. More often I'll use testicle, but again, every person is different. So depending what they need. I also use it a lot for musculoskeletal injuries. Like I remember when I screwed up my knee a year or two ago doing this one hike, Lurong, literally from when I took it to the next day, it made the biggest change in how my knee was recovering. So a lot of the times, if you have labral issues, tendon issues, things like that, I do see Lurong to be beneficial also. So it kind of multiple aspects, but I definitely will use it in women also.
Yeah. And then for the guys, like testosterone support, which I think I think it's necessary because we live in a very, again, toxic world. And then a lot of the toxins are very estrogenic based. So, naturally men's testosterone, no matter, no matter whether you like it or not, your testosterone is not as optimized as males back in the day. So what are some things that that males can use? Right, for me, I would say Lurong, right, the sheep testicle, maybe like an ashwagandha to counteract cortisol, right? Maybe like rosemary or something like that for estrogen, right? What's your take?
I mean, everything you said, I agree with. Lurong and sheep testicle, I use both of those. From an herbal standpoint, the two probably I would use, and oftentimes I like to combine like the testicle with herb. So the two that I'll use is ashwagandha. Ashwagandha is just an awesome herb, but also shatavari. Shatavari, like I said, I've used that with women a lot, but there's a lot of studies how it'll increase the luteinizing hormone and then it can increase testosterone production. So like the testicles giving the testes the raw material to make testosterone, and then the shatavari is talking to the testes, telling them to produce more. So I do see that be beneficial. There's a bunch of herbs that I have seen work. So everyone's unique, but again, shatavari or ashwagandha with the testicle or the wrong, I see most often. Definitely if you have the, shifting over to estrogen, rosemary can be beneficial. One herb that I don't use as much, but I do see be really potent in some people is mucuna.
Mm.
Mucuna is one that it contains L-Dopa, so it's a good mood elevator, increasing dopamine. But there's a lot of good studies, men and women, how it can increase sperm count, it can increase testosterone, a lot of good reproductive benefits.
Yeah, Mucuna is actually a good testosterone booster herb, I think, too. So working on that same pathway,
Yep.
right? Those catecholamines. So yeah, I think that one is overlooked too. And then for female hormones, I feel like a lot of times people think of female hormones as just estrogen, but I think of a lot. I think more of the work actually needs to be put on progesterone as well too. And usually if it's like estrogen dominance, I would say maybe it's more so toxicity. Um, but I would say a lot of females, because of stress, lifestyle, etc., their adrenals are really shot. They actually have really low progesterone, and I see that on labs too, right? Not just a theory, but I see that over and over. Is the two things: low thyroid, low progesterone. So, what are you kind of using for that?
So, it definitely depends on which hormones are off. So, shatavari kind of works on estrogen and progesterone, a little bit of both. I look at it as gentle in both of those, but it does work in both. For increasing progesterone specifically, chase tree is my favorite. Um, it's a really good one for increasing progesterone. But it's a strong herb. I once just told my wife to try taking it for a couple days, and it just put her in the biggest mood swings. It was like, oh, okay, she doesn't need that hormone support right now. So chase tree wasn't for her. But chase tree, I think of for progesterone. Shatavari kind of all around. Ashwagandha again. Adrenals help support hormones. Ashwagandha is a really good one. And then mostly, like you mentioned, I see women over and men over estrogenated all the time. We have anything down to the receipts that we're touching to the hormone fed cows. We're getting estrogen from so many different sources. If you have a fungal issue, that's going to overload your liver. Your liver can't break down estrogen. So yeah, most of the people that are over estrogenated, it's not their ovaries are producing too much. That's rare. But if you can get rid of a fungal issue, I see that get rid of estrogen dominance all the time. But you do have women that are low estrogen, especially post menopause. I always say the healthier a woman can go into menopause, the healthier her adrenal glands are, the better she will have menopause. But women and men, we're all stressed so much. Our adrenals aren't healthy anymore, sadly. And so black cohosh I've used a lot in women and it's done wonders. Any type of menopausal type symptom, black cohosh will increase estrogen. So for women that are having those low estrogen type symptoms, I have used it in a handful of younger women, but much more often it's that peri to post menopause black cohosh. It's become my favorite menopause herb.
Yeah, that's a very classic one, black cohosh, and it's exciting because now I know I'm like, oh, it's clean, right? Because sometimes, and a lot of times you can't find a good product that is just black cohosh. It's always with like another eight other different herbs, where you don't know if that's
Right.
going to create some issues or not. So that's cool. Um, I was gonna say one thing about adrenals. There's now we mentioned ashwagandha, but there's also other ones like Tulsi. We got endo, right? Is there sort of like nuances how to decipher, which one's the better one to use in this different
You
scenario?
know, So we have kind of like four main adrenal herbs, which you mentioned. Endo, which is like what they call it. It's not ginseng, but it's like South American ginseng. Tulsi, which is holy basil. Ashwagandha, and also American ginseng. So those are kind of the four ones that we have. Some people, and you might have a better explanation than this. I mean, for me, if I evaluate a client doing my applied kinesiology, I find out what they need and I give it to them and it does great. For other people, it's almost like trial and error, which I hate. But it's like, okay, let's do ashwagandha for a month. If it helps, amazing. If it doesn't, let's try Tulsi. If it helps, amazing. If not, let's try Endo. Probably I use ashwagandha or Tulsi the most, and then Endo, and then American ginseng. So kind of in that order. So that's if you were going to try it out, that's how I would try it. And I would say, you should notice at least some benefit within a month, good benefit, so you'll know within that amount of time. I know when I was in school and super stressed out, Tulsi is what did wonders for me. Like I was taking a hefty dose of Tulsi and I felt like I had caffeine when I hadn't, and I felt really good energy all day long. And I probably needed it for like 4 or 5 months, and then I was able to stop and still feel good. you know, if your stress continues, it's tough. But ideally, with adrenal adaptogens, they're not a stimulant. It's not like just caffeine. It's not poking you go, go, go. It's restorative. It's ideally helping your adrenal glands to heal. So, a lot of the times, like, let's say if ashwagandha or Tulsi or endo is really helping you, then I would say after, like, let's say 2 bottles, take a break for a week. And if you feel a little more run down, get back on it. You got a lot of stress, you're not done with it. Versus if you stop it and you feel great and you continue to feel great, then hopefully that means one, you've dealt with a lot of your stress, your emotional, your physical stress, you're handling it better, but also the herbs help to heal and restore your adrenal glands. My goal is not for someone to be on an adrenal stimulant the rest of their lives. I mean, I've had way too much stress lately, so I probably should be on something until I figure that out. But, for most people, ideally, you can take it to help your body restore. You live a good lifestyle, and then we don't have to continue to be on them.
Yeah, very well said. Another thing with ashwagandha, as you were saying, that is, I think it's really good for sleep. I think people, when they go on ashwagandha, they always say that their sleep is a lot better, which then equates to everything getting better. Their blood sugar, their energy levels, no energy crash, their recovery. I mean, that's so key. Any other things that that you're like, oh yeah, this is really good for sleep?
So with one thing with the adrenal herbs, it's interesting. Ideally, with like Tulsi or ashwagandha or endo, they give you energy and they help with sleep. They work on both. They're not stimulants, they're not downers, they work on both. On rare occasion, I'll have someone that they take it in the morning and it makes them tired. So I'm like, take them all at night. Or some people, it just ramps them up. So take it all in the morning and that's fine. Like you said, I've recommended ashwagandha or Tulsi and it's done wonders for sleep. But my absolute favorite herb for sleep is Albizia. Albizia julibrissin, it works on GABA receptors and also 5-HTA, which then can turn into melatonin. And I use it a lot for insomnia or sleep issues. And for sleep, I usually tell people if it's trouble falling asleep, take 3 pills 30 minutes before bed, versus if it's trouble staying asleep, take 3 pills at bed. Again, it doesn't work for everyone, but I have had the most success with Albizia versus anything else. I remember one of the first patients I ever gave it to. The next visit, she's like, wow, Albizia, it's like taking a Xanax without the hangover the next day. And I'm like, that's awesome.
The happy herb, I think it was called,
Yeah.
right? For yeah,
A lot of people
it
use it for
uplifts the
depression
mood.
also. Yes, 100%.
Yeah. Speaking of which, in the world of things like anxiety, well, not so much anxiety because I think that's more like it could be more like adrenal things and how people handle their life. But anyways, in the world of like depression, anxiety, mood issues, etc., what are some ones that you're like, yeah, these are key players or very commonly used?
I mean, from the herbal realm, a lot of it is either going to be Albizia, which I use a lot for anxiety, but also it's a classic for depression. Um, Ashwagandha is another one. Again, I've mentioned I don't know why I've mentioned that a lot today, but that's another good one for depression and for mood. Mucuna, because of the L-DOPA, that'll convert into dopamine, which is then a mood elevator. Those are some of the main things that I will use. I mean, it's pretty amazing though, too. It's like you can't ever take things out of context. You know, With patients, I've had some where you take them off gluten and all their depression goes away, or some where you take them off dairy and all their depression goes away, or some you deal with that parasite or deal with that fungus in the gut and their mood increases because, I mean, isn't it, I don't know, 5 times more serotonin's made in the gut than the brain or something like that? It might be way more than that.
Yeah, well, most of the serotonin, like 90, 95, depending
Oh,
on what you
okay.
quote,
So
is
way
made
more
in
is
the gut.
coming out. Yeah.
Yeah,
So, a lot of people, if you can optimize the gut health, then that alone will help with it.
yeah, 100%. And some ones that we didn't mention that I think are very cool to mention is like, well, vitamin C is a big topic, right? So your camu, acerola, I think those are like well used as well, especially acerola it also tastes good. That's cool. I like how acerola tastes good. So easy there.
It, Camu, I absolutely love. It's something that whenever I travel, it always goes in my backpack. Again, so we don't do extracts, we do whole herbs, or in Camu, it's a berry. So one pill, on average, a batch is about 6% vitamin C. So per pill, you're getting about 36 milligrams of vitamin C. If you compare that to doing 2,000 milligrams of ascorbic acid, it's pretty minute. And on occasion, I will use ascorbic acid. It has some times and places. But it's cool because Camu, number one, it's true vitamin C. It's not a man-made synthetic. It's actual C. You have the bioflavonoids and the other cofactors that go with it. And I see people that do a much lower dose, but it works amazing. It works better than ascorbic acid, so it's a lower dose, but it's the real form, so it works better. For like general immune boosting, I might have people do like 4 to 8 Camu a day just to kind of help support the immune system, vitamin C. But if I ever feel like I'm coming down with something, I will take like 8 Camu 4 times a day. No, well,
Wow.
actually, sorry. I'll take 8 to 12 Camu 4 times a day.
Wow.
I will hyperdose it, and I see it work amazing for colds or flu that are coming on. I will say, of all of our products, the three that taste the worst, Malia, Golden Thread, and Camu, they taste the worst. If
Yeah.
you ever get a Camu that tastes good, most likely it's Camu juice spray dried on maltodextrin. So that's why it tastes good from all the sugar. But so Camu, I've never been able to get my kids to take. I mean, I just want to gag if I drink it. So we came out with acerola. Acerola tastes good. Kids love it. I give it to my kids when I travel. It's weaker, is what I will say. So for anyone that can swallow a pill, I love giving them Camu. But for little ones, until they can swallow pills, acerola is the best vitamin C in my opinion. Just really good for immune system, and we're traveling coming up, so that's what I'm bringing for my little one that can't swallow pills yet. She'll be getting acerola every day just to kind of boost her immune system with the flying and whatnot.
And speaking of the immune system, what else do you love? I really love like woad, andrographis, astragalus, um, elderberry. How can I forget elderberry? Right? Those are ones that are just. I feel like when I travel, I always have those.
Those are all great immune boosters, and again, like everyone is different. So I can't say what's the best for everyone. Astragalus is a great one that you can take more long term if you want. It's immune modulating. It's also antiviral, so it has a lot of great properties. The others that you mentioned are awesome. Andrographis, Camu, just from the vitamin C content. And then going back to the glandular aspect, sheep thymus. Again, your thymus is a big immune related organ. So like heals like sheep thymus, I've definitely seen help. It's very similar to Camu. They work on completely different aspects, but I look at it as immune system support.
Yeah, I those I really love using thymus for like if people just have really long-term reoccurring infections or if kids are like, man, it seems like every month they're getting sick, like
Mhm.
get some glandulars in them. Thymus is a really good one for that. And all right, so just some key ones that I feel like needs mentioning is like some heart stuff because everybody's kind of worried. Well, not everybody, but a lot of people are worried about their heart these days.
Mhm.
But what are some cool heart stuff, heart herbs that you like?
Um, I'll talk about 3/4. I mean, you have different aspects of heart. So one, you have blood flow. And when it comes to blood flow, Danshen is my favorite herb. So Danshen it's the top cardiac herb in Chinese medicine. Danshen is cool because it is a platelet aggregate inhibitor, so it makes your platelets less sticky, so your blood flows better. It also is fibrinolytic, so it helps to break down blood clots in the blood. And Danshen also increases nitric oxide, so it makes the blood vessels in the heart bigger. So Danshen is a really awesome herb from a blood flow standpoint. We have another herb combo, Hemoguard, which is great also. Neither I would use if on a blood thinner, but Hemoguard and Danshen are both great for blood flow aspects. For people that have a history of heart attacks or strokes or miscarriages, those people I see do really well on something like Danshen or Hemoguard. Then from a cardiac aspect itself, the two things that I'll use the most, I mean, especially from the past few years, a lot of people have had, myocarditis and other subclinical heart issues. The two things that I'll use most often then, one is going to be hawthorn. Hawthorn is a classic cardiac restorative, kind of like an adrenal adaptogen. It helps the heart to heal. So hawthorn I've seen work really, really well. And then also especially again from post jab and things like that, cardiac issues, I have seen sheep heart do well. Sheep heart, it's high in L-carnitine, which is needed for heart health. It's high in CoQ10. It helps muscle repair, and the heart is basically just a big muscle. So, hawthorn and sheep heart are the two that I've really been working with a lot for, again, heart restorative. I'm not sure if any of that actually just came through. It's been buffering on my end for a minute, but hopefully that all got recorded.
I still hear you.
Okay.
Yeah, there we
So
go.
that's how I've been looking and working on cardiac issues.
Beautiful. Okay. I think we got most of it. I think we talked about any honorable mentions or things that you want to end with.
Not really. I mean, it's just, working with herbs are fun. If you look at every native culture, they incorporate herbs as part of their diet. And back in the day, it was like you grew your herbs and that's where you took. Nowadays, we're all exposed to so many different things on a daily basis. We're exposed to pathogens, parasites, viruses, fungi, bacteria from all over the world on a day-to-day basis. And that's why I think bringing in herbs from all over the world can be really beneficial, not just the local ones, because we're exposed to so much. And definitely, with liver, Schizandra, our livers are so overwhelmed nowadays from all that we're exposed to, as well as our adrenal glands. And, it's interesting if you look at, and it's, some things like liver support or adrenal support, you can make a good case that most people need them on a day-to-day basis. But then, if you look at the strong antimicrobials, there's some really cool articles that I found talking about how they found animals like chimps, and they would eat certain plants in the jungle only when they were sick. They didn't eat them any other time. They ate them when they were sick. So it's like we had this innate call. And then those herbs they did studies on, they found they actually had antimicrobial properties. Then the animal got better and they didn't eat the herb anymore. So it's like the animals, the animal kingdom has this innate intuitiveness to know what is wrong and what they needed to fix it, and we've lost it. And I mean, I think that's why working with someone in person like yourself or myself really is so beneficial, because we can help figure out exactly what a person needs. But, like we talked about when talking about parasites, people can play around and try on their own, and ideally you're going to get better. You shouldn't screw yourself up. And then, when you get stuck or need more guidance, working with someone like us can be so necessary and help.
Yeah, very well said. I think because herbs are nature's medicine, so having that knowledge, and I definitely appreciate you taking the time today to explain everything in detail. Again, it's Supreme Nutrition is one of my biggest arsenals that I use because of the purity, the cleanliness, right, and just what it does. I want to know that things are being done right, and also whatever I take is not adding on to more toxicity and issues like that. But just using God's medicine, nature's medicine, to help us intuitively just makes most sense to me. So I think that, it's different from medication, because medication, I wouldn't just say, hey, yeah, go ahead and try whatever medication, because you think you have an issue. There's a lot of there's a lot of sketchiness with that, and people can have really bad reactions. It's because it's a synthetic product. But when you do something natural, and the way kind of God designed it for us, most of the time we're really not going to run into too many issues, and that's what I really like about it. So, all right, well, thank you, Noah, for taking the time to explain all of this stuff. Just give us a quick shout to where people can find you, and resources and things like that, and maybe some future things that you're involved in.
I mean, just like with Dr. Calvin, I think both of us, there's so much free info we both have on our Instagrams. Dr. underscore Noah DC, be sure to check us both out, and you can get a lot of great info from both of us. And that's where usually I share everything. So, please, I hope you all learned something from this and it can be beneficial for your health.
Beautiful. Okay. Thank you, everybody. We're wrapping this up, and I'm going to stop.
At the very end, it's